We have to talk about leg weakness and the pelvic floor because everyone that I see, whenever they think something's going on with the pelvic floor, the first answer that they think we should be focused on is doing more Kegels. And just to let you know, Kegels are not always the answer. They can be a good answer in some cases, other times may not be the first thing we jump to, but we also need to consider leg strength. The strength in your legs is going to directly impact your pelvic floor. And we'll talk a little bit about how that happens. But the first thing I want you to know is that your pelvic floor needs more than just Kegels, okay? It needs for other surrounding structures to be strong and also offer the stability that's needed. Because your pelvic floor muscles, they're postural-based muscles, so they're going to be active a lot more than what other muscles will be. And they also will need to be able to turn on and respond very quickly. So keep that in mind when you are looking to improve pelvic floor dysfunction, whether it be incontinence, whether it be pain, whatever may be going on, or even just working towards getting a stronger pelvic floor. So why is your leg strength so important? Well, did you know that there's a study that was done on elderly individuals that indicated that individuals who had a hard time with a test called the sit to stand test? So it's a test where you sit in a chair with your arms crossed and you try to stand up and sit all the way back down as quickly and safely as you can in about 30 seconds. And then they count the number of times that you can do that. Well, individuals who could not meet the baseline, they actually had a harder time maintaining pelvic floor function, and they were associated with higher risk of incontinence. So keep that in mind, because why is that important? Well, these individuals already have mobility issues, so they're probably having a harder time getting to the toilet, but now they also have a strength issue. So we have to focus on your strength in your legs. We also need to consider that your pelvic floor is going to work directly alongside the other muscles along the hip, pelvic girdle, your lower back, your abdominal region, those different areas. And those areas some of those muscles are part of your leg muscles, if you consider where they attach as well. So keep that in mind. We want to make sure you have strong legs. So I actually want you to give it a try. Are you able to stand up out of a chair without using your arms? If not, we need to work on that. If you were to lay on your bed or even flat on the ground, can you pick up one leg without holding your breath? If not, we have to work on that, because those basic activities are things that you should be able to do that indicate that you have good leg strength, and also that you are able to cue in other muscles, especially your trunk muscles, without having to compensate with that breath hold or using your arms to push. Your glutes are so very important when it comes to your pelvic floor, because there's actually a neural-based connection. So there's a connection with your glutes and your pelvic floor related directly to the nervous system. So if your glutes aren't kicking in, as one of my patients put it, if you have office butt, meaning your butt is super flat or even kind of caves in now because your posture is not as good as what it used to be, then your pelvic floor likely is responding. If your pelvis is tilted posteriorly, meaning that now that natural curve in your back has flattened and you actually may sit or stand more like this because your hips around it, it can be because your hamstrings are tight. It can be because your glutes are weak. It also can be because that you don't have good core strength. But that position itself is going to impact what portions of your pelvic floor respond whenever you try to kick those muscles in. So if you're stuck in that posterior tilt position, the back of your pelvic floor may be more active. So think about it. Do you have things such as constipation going on? Are you noticing increased pain? Are you noticing that lightning bolt, especially if you're menstruating, that happens in the rectal or anal region? If so, take a look at your posture, because it can be something as simple as changing how you're positioned to indicate that you're not getting too much activity with those muscles. Now, on the flip side, if your pelvis is anteriorly tilted, meaning like the arch seems a little bit more in your back, then your front of your pelvic floor may be more active. So take those things into consideration, so that way you can see, hey, am I noticing I'm having a hard time relaxing when I need to urinate? Am I noticing that, I have more pain in this area? Am I noticing that I can't get a good contraction? Sometimes you can't get a good contraction, not because your body is super weak, but because those muscles are very tight. And now they can be tight because they're weak, but if tightness is the biggest issue, you have to learn how to first relax those muscles. And if the glutes are not kicking in, your hip muscles itself, like on the outside of your hips, are not progressing as well as what they should as far as your strength goes, then that is going to impact how your pelvic floor responds. There's one muscle that is really popular in the pelvic floor world, And that's a muscle called your obturator internus. Now, if you've never heard of the muscle, that's okay, because most people haven't. But this muscle works directly alongside your piriformis. Now, you may have heard the piriformis muscle. Now, both of these muscles, they help with external rotation, so turning the hips out. So if you're sitting, right now, I just want you to point your knees out to the side. That is external rotation. And these muscles help with that motion. But look at how you're standing. Do you stand naturally with your legs already in that position because those muscles are tight or because those muscles are weak? Are those muscles not kicking in as well as what they should? Because guess what? Your obturator internus and your piriformis have a direct connection to your pelvic floor. And if those muscles are not working properly because of weakness or because of tightness, your pelvic floor is going to respond and may even bear the brunt of the force. So consider that when you're noticing that you're having pain. And also, because I mentioned piriformis and I mentioned obturator, I have to tell you, it's not always sciatic pain, y'all. But those muscles can contribute to that type of pain as well. So let's consider, are you doing enough hip strengthening? If not, I want you to make sure that you add in some different things that you can do to focus on getting your legs stronger. One that targets your quads and your glutes, squats, something as simple as that. In that test I mentioned in the beginning where you're sitting in a chair and then you're standing up, that sit to stand test can be really easy and simple and no fancy equipment's needed. And then depending on your balance, your strength, you can progress that from sitting and standing using both your legs to even trying one leg. But if you notice your balance is off, please don't try one leg. Stick with the two legs and focus on doing everything that you can. Even if you want to add a weight vest or add weights to the exercise itself, that can be helpful. And you don't have to buy fancy weights. You can even just fill up gallons of milk bottles with water, and that can count as your weight. But having good leg strength is going to be so important. So do a quick test with yourself. Are you able to stand up out of a chair without using your arms? And don't hold your breath. Are you able to lay on the ground or even on your bed and pick one leg up without holding your breath? And now flip onto your stomach and give that leg raise a try again to test out your glutes. So now on your stomach, try to lift that leg up again. A lot of people have trouble and difficulty with this. And if you fall into that category, then your pelvic floor may not be functioning as well as what it should be, simply because your legs are weak. So start doing more leg strengthening so that way you can allow for your legs to help you and also work alongside better with your pelvic floor.